Hello everyone, I'm Hichan Yang. Today, I'm gonna tell you guys about some of the dental treatments and disease, pericoronitis and wisdom tooth extraction. Before I start my presentation, let me tell you the concept of my presentation. There is a patient who felt a serious pain in the lower right gums. I'm a doctor and I examined a patient. As a result of the examination, there is pericoronitis in the area around the wisdom teeth. So the patient need wisdom tooth extraction. And I will give the patient some explanation about the treatment. Sir, the reason your lower right gums hurt is because of pericoronitis. Let me explain about pericoronitis. Pericoronitis is an inflammation of the gum tissue that appears around the tooth that is incompletely erupted. It most often occurs with the wisdom teeth, also called third molars. As you can see in this picture, your gum tissue is inflamed, and that's why you are feeling pain. And let me tell you the cause of pericoronitis. The most common cause of pericoronitis is food, germs, or plaque trapped on the loose gums. The space is formed when the wisdom teeth begins to come in. Before the wisdom teeth occurs, gum tissue covers the area completely. As the wisdom teeth emerges, only part of the tooth is remained covered under gum tissue. The space between the teeth head and the gums covering the teeth is a great place for food residue and germs to accumulate. Usually, wisdom teeth is grown in sideways, so the food can easily become trapped. So, if the food and germs are accumulated in the space, inflammation can be occur. Then, what is the symptoms of pericoronitis? You may realize that you have pericoronitis when your back gums are swollen or red and painful. You may also have a bad taste and a pus or odor in your mouth. And you may feel difficulty opening your mouth wide. If pericoronitis is left untreated, a much more serious infection can be spread to the neck and chin. So, in order to treat pericoronitis, you must extract the wisdom tooth. But don't be afraid, I'm going to give you a local anesthesia. Local anesthesia means to numb your teeth. You may feel some pressure during the procedure, but you won't feel pain if you get local anesthesia. This is a consent form for anesthesia. If you want to be numb, sign here please. It tells you what could possibly happen during the extraction and after the extraction. Complications are very rare, but you should be aware of the risks. Please carefully read each sentence. If it's not clear, feel free to ask any questions to me. Please sign on the patient's signature line if you fully understand and consent to the procedure. And now, I will tell you the price of wisdom tooth extraction. Wisdom tooth extraction treatment is covered by health insurance, which subsidize some of the medical expenses to patients in national health insurance. Therefore, the price is not that expensive. The cost of the treatment depends on the condition of the wisdom tooth. If the wisdom tooth is fully erupted, The price is 11,500 won to 20,000 won. And if your wisdom tooth is partially erupted, the price is a little bit more expensive, 17,500 won to 30,000 won. If the wisdom tooth is totally unerupted, the price is 31,300 won to 60,000 won. Your wisdom tooth is partially erupted, so the price will be about 20,000 won. This time, I will tell you the process of wisdom tooth extraction. To understand the process of the treatment, you need to know a little bit about the structure of your teeth. Teeth are composed of dental crown and dental root. I will separate the dental crown from the dental root and then remove the crown first, and after that, I will remove the dental root. Now, I will tell you the process in detail. First, I will give you enough local anesthesia to the area with wisdom teeth. That's why I got a consent form from you. You won't feel pain if you get local anesthesia. Next, the gums will be incised and tilted to fully expose the teeth and bones buried in the gums. During this procedure, I will use a surgical knife. I will be careful not to hurt the surrounding tissue. The third step is to split the crown of the wisdom tooth by tooth cutting device and remove the surrounding tooth bone that interferes with the extraction. You may feel afraid that the tooth cutting device will go around to high speed with a loud noise, but we need your cooperation to ensure the treatment is well completed. During the process of cutting teeth, the nerves in wisdom teeth are often cut together. So if your teeth are very sensitive even after anesthesia, you may feel some pain. The next step is to remove the remaining wisdom tooth roots. In most cases, dental root comes out easily if the teeth crown is well divided. So this step is quick and easy. This is the final step. I will remove the inflammation and you should disinfect the surgical area. And I'm going to stitch the surgical area. When I sew the incision back on, the surgery is done. After the extractions, there are some instructions that you must follow. First, you have to bite down on the gauze pad for 2 hours in order to make the healing process successfully. And you must swallow your saliva and blood. This will help your blood clot to remain on the surgical site. A dry socket may occur if you lose a blood clot. And please avoid drinking alcohol or carbonated beverages for at least a week. If you drink such beverages, it can interfere with the healing system of the gums. Also, you must take all medications as prescribed. I will prescribe antibiotics and painkillers for you. After the tooth extraction, you should consider getting an implant as a follow-up treatment. Implant is a dental treatment for removing damaged teeth and planting artificial teeth. The biggest advantages of implants is that they can be treated without damaging a jagged teeth. Chewing function is preserved excellently and the implant is easy to manage. So think about getting implant treatment and let me know next time if you want to get it. Okay, this is the end of the conversation with the patient, and this is some URL that I referred to it while preparing for my presentation. So today, I explained about pericoronitis and wisdom tooth extraction and implants. It was good to learn more about these treatments while preparing for this presentation. Thank you for listening.